Another PLAB2 station was Dr. Al. Someone texted me and said, I'm struggling with autoimmune conditions. Genuinely don't understand the struggle with this. They're very straightforward. It's a medical station. Hypothetically speaking, autoimmune conditions, well, the only thing on my mind, to be fair, are rheumatology conditions. So hypothetically, if the patient came with with history of pain in the joints of the right hand, you're gonna start the history taking just like you do in every station. The key point here to ask about other joints, you want to exclude septic arthritis, because septic arthritis is an indication for same-day referral to the A&E, or if you're in A&E, well then it's an indication to admit the patient. You want to ask about trauma as well, because you might want to refer the patient for surgery, you might want to refer the patient for MR, for X-ray. So once you've done all of these with the hands, then you've excluded other causes. So it's not septic arthritis, it's not trauma, it's definitely autoimmune. The risk factors. While you go through the history, remember that smoking is a risk factor for autoimmune conditions. In the part 2 of the history, smoking would be in part 3, by the way. In the part 2 of history, once you ask any other medical condition I need to know about, feel free to name one or two that might come, like diabetes, autoimmune condition, might be with rheumatoid arthritis, like issues with the thyroid, hyper, they might come. So you carry on now with the examination. You go into specific examinations. You want to mention the special ones for rheumatoid arthritis, so your consultant in the room would know that you know them, like Tinel, like Fallon, like squeeze test. You don't have to do them, you just have to verbal them. You go into the management as usual, 5 points. At this step, do you want to do more investigation? Most likely yes. You want to go for immune profile, immunology profile. You want to go for some X-ray properly, or MR, or God knows what the station would be about. Senior, at this point you don't need senior. Referral, you do need referral. If you can prove that this patient have rheumatoid arthritis, you need to make a referral as quick as possible to the rheumatology to start this patient on the proper treatment for rheumatoid arthritis, which is DMARD, because studies show the earliest you start with it, the better the outcomes are. Now in the clinic, you're going to concentrate on the symptomatic treatment for the pain. You're going to concentrate as well on the physiotherapy. You're not rheumatologist. You're not immunologist. You don't play with the autoimmunes. You refer. You're an FY2. It's not our job. Our job is to manage the symptoms. Then definitely you give lifestyle advices and vaccinations.